Hello everyone, welcome to Aptly Place Academy for Civil Services. I welcome you all to the new learning segment via our new initiative that is News in Focus. So today's topic discussion is right to health. This is something which was there in news, is specifically going to be relevant for both prelims and mains examination, and it will also help you to form an idea so that you can have a complete picture when it comes to right to health. So without any further delay, let's get started. So what has happened, why we are discussing this news? So recently, the budget session that was concluded by the Rajasthan government in Rajasthan Assembly, they have advocated and again pitched a debate for right to health bill. Now this specific bill will call for right to health, and how this is going to help. By this bill, if it is passed, it called for a mandatory free and affordable medical services in hospital, clinics, laboratories, both in private and public owned hospital. Now, when it comes to public hospital, everything is fine because they have to adhere to the government rules and regulation. But the private owned hospitals are not very happy with the government move. Still not passed. We'll see whether the government is going to have a stake of the private hospital also. Now, one thing that is important for the prelims examination perspective, that health is under the state list. We have three lists under 7th schedule of the Indian Constitution. The first is called center list, or you can call it union list. Then we have state list and concurrent list, right? So the state government are authorized to make laws on health as because this is listed under the state list. Now, union government या central government भी rules बनाती हैं, but that is on the public interest, right? Now, what are the constitutional right to health? Whether the Constitution of India provide for right to health? See, Constitution of India does not expressly guarantee the right to health. कहीं भी कॉन्स्टिट्यूशन में राइट टू हेल्थ की जिक्र नहीं की गई है. दिस इज समथिंग अ नोशन दैट इज गारंटेड बाय Article 21 of Indian Constitution, which is more an elaborative part of right to health and liberty, right? Now, there's a specific part that is mentioned in the Directive Principle of State Policies. This is going to be relevant for examination also, specifically if you're writing in mains examination, although this will help you to get the part of the foundations. Now, what are the details that is mentioned in the Directive Principle of State Policies? Now, DPSP में कुछ तीन ऐसे articles हैं that is going to be relevant. The first is Article 39E, which directs the state to secure health of worker. This is one. The second is Article 42, which directs the states to just and human conditions for work and maternity relief. And the other is Article 47, that casts a duty on the state to raise the nutritional level and even the standard of living for the people and improve their public health. So these are some of the defined part which is specifically mentioned in the DPSP, that is Directive Principle of State Policies. Now, Constitution has not left this to this extent. They have also part in the some of like panchayats or municipalities में भी इसे extend की गई है, where Constitution has obliged the state government to enhance the public health in panchayat and municipalities through the public health under Article 243G, which is 11th Schedule Entry 23. So these were some of the factual information relevant specifically for the prelims examination. Now, if you see the budget expenditure, when it's come to the health, we have to consider the fact that what are the budget. Before I jump to the provisions that Rajasthan government has actually planned to table, उससे पहले budget को देखें. Now, for this year, the estimated budget, the revised budget estimate is 2.1 and against 1.6, which was there in the financial year 21. This is important. Why? Because India has just witnessed the wave of COVID-19. COVID-19 की अगर बात करें, this has shown picture where we have seen the devastating effects of the pandemic, and even it has called for restructuring the part of healthcare system in the country. Now, provisions की अगर बात करें बिल की, जो कि राजस्थान गवर्नमेंट ने टेबल की है, and even it call for a debate. So it has clause 3 and clause 4. First, with clause 3, it lays down 20 rights to the state resident that they will be entitled with, specifically for the गवर्नमेंट ऑफ राजस्थान, स्पेसिफिकली जो वहाँ के लोग हैं राजस्थान के, उन लोगों को ये बेनिफिट मिलेगी. दे विल बी प्रोवाइडेड with free diagnostic and treatment, receiving treatment without any discrimination based on caste, class, age, gender, etc. Now, there's clause 4, which shifts the burden and responsibility providing adequate medical services to the government. और यहाँ पे प्रोवाइड की जाएगी फंड की, इंस्टीट्यूशनल सेटअप होगी, एंड इट कॉल फॉर कॉन्स्टिट्यूटिंग द ग्रीवांस रेड्रेसल सिस्टम इफ एन इंडिविजुअल इज नॉट प्रॉपरली टेकन केयर ऑफ. Now, even the clause 4 provide for human resource policies, जहाँ पे equitable distributions of doctors, nurses, healthcare workers, सारे level पे across the system they will be working. So there will be a complete restructuring policy for the human resource, specifically for the doctors. Now, what is the aim of this bill that Rajasthan government has come up with? The first aim is to provide patient and healthcare providers. It also called for, this will provide for rights to patient and healthcare provider first. Second, place the obligations on government to protect this legal right. And last but not the least is to mandate the setting up of grievance redressal mechanism. Now, apart from the aim, what are the advantages that will be there for the people of Rajasthan? So the resident of Rajasthan will be entitled for free checkup. Drugs will be drugs. By drugs, I mean the medication which is there. Diagnostic, emergency transport in all public health institutions at affordable rate will be there, and even the surgeries which will be done will be at the subsidized rate. The bill framers call for public services rather than vehicle for making money. So health is something which should be taken, which should be treated at the minimum price, because in India the health expenses is high. So this initiative by government is very appreciated. Now, the Rajasthan government has tabled their right to healthcare bill in State Assembly in September 2022 itself. So these will be some of the major advantages of the bill if passed by the Rajasthan government. Now, if you see what next in this context, so it is a time that India should have a right to health as a fundamental right. If you talk about the cooperative federalism, they need to have a coordination between the center and the state government, specifically in the health segment, right? And this will call for building the societal resilience with future pandemics and public health emergencies. So this will be a precautionary measures that both the state government and the central government will be taking, and it should be implemented using the principle of transparency, proportionality, and solidarity. So these are some of the things that must be taken into consideration, and there's a reform that is essentially required when it comes to right to health. So this was all about for this topic. If you are new to our channel, do not forget to subscribe Apti Plus Academy for Civil Services on YouTube. If you like this video, if you find this video informative and helpful for examination purposes, do press a like button. And I thank you all for watching this video.